I really try in my practice to bring this up very early. And I like the partner or the support team to come to the appointment. How are we, and what I think is really important is to know yourself, know your epilepsy, know what your triggers are, and have a supportive team. So for example, let's talk about sleep. If sleep deprivation is a real trigger for you, I don't necessarily want you being the person up every 2 to 3 hours and not getting sleep. Now, if you're a person who can breastfeed and fall asleep when the baby sleeps, and that works for you during the day, then that may work for you. But if you're somebody, and I can tell you personally, that when I'm up, I'm up. I'm not that person who can doze off. I'm somebody who needs a long stretch of sleep. So if you're somebody who really needs that long stretch of sleep, you're going to need a plan. You're not necessarily going to have to be able to, feed that baby every 2 to 3 hours. So I think, as I said, knowing your triggers, knowing your seizures, knowing your epilepsy, and knowing yourself is really important in this time period. So getting enough sleep, how is that going to happen for you? And very likely you're going to need some support. If you're breastfeeding, we talked already that we encourage that. You may want to supplement one of those feeds either by pumping or using supplemental formula to have somebody else feed to allow you to have that one stretch. So that's sleep is definitely something that's important. Seizure safety, think about that. If you're somebody who is vulnerable at risk of having seizures, you should not be bathing that baby alone. You should do that with somebody with you. Walking across the room. Dr. Gerard brought up a very good point when we were sitting around talking about this, is those baby carriers. Those are not good for people who have seizures. Don't use those. Have a stroller. Put the baby in the stroller, walk across the room with the stroller. So think about those. So the sleep piece and the safety piece, and surround yourself with individuals in your family and friends, family, or if necessary, hired people if you have the means to help you get through that in the safest way for you and for your baby. And again, for just like pre-pregnancy planning, those issues are best discussed prior to delivery and making sure that you have the support you need that's safe for you and for your baby.